Hello, everyone. This is Dr. Artis, and this week with your weekly adjustment, I'll be talking about stroke prevention and recognizing the symptoms of a stroke. One of the things that I want to let you know is this is one of the things that I do every month. On the second Friday, I do a program called Walk with the Doc with a neurologist, who's a good friend of mine over the years, and we talk about this stuff a lot. We're starting to see people develop strokes younger and younger with age, and I want to give you some tools today to actually see if you can do anything to help you from and prevent you from having a stroke. Or if you're like right on the borderline, you had a stroke, you can implement some of these things to actually help you from having another stroke. And this is one of the things that I want to start with. So first of all, we got to ask the question, what is a stroke? Number one is a stroke occurs when a blood vessel in the brain becomes blocked or actually bursts. And this can interrupt the blood flow to the brain, which causes a decrease in oxygen. If it happens on one side of the brain, it's going to affect the opposite side of the body. Or if that happens, and those two things that can happen when it says a blockage is this ischemic stroke. And then the other type of stroke that happens is a hemorrhagic stroke. And that's where it's bleeding on the brain, okay? These are both very dangerous and they can leave you incapacitated if not caught early enough. A lot of times there's a window that if most people can get to the doctor, depending on the type of stroke they have, or hospital in time, they have to say that they think they're having a stroke, and they're going to push them straight to the front of the line because they can get certain types of medication that could possibly even reverse some of the side effects that could have caused some damage. But the longer that you sit there with that blockage of the brain or that bleeding on the brain, the more damage is going to occur. That could be irreversible. So one of the things that people used to come out with this program called FAST, but I want to add two more letters to it, or two more words, and it's called Be Fast. And that's one of the things that people notice when they have a stroke. So what happens could be is your balance is off, or they just all of a sudden they just get dizzy and don't know exactly where they are. The second thing can happen is the eyes. The eyes, they start to all of a sudden vision loss, or one eye is just blurred for no reason. That's showing signs that could possibly be a stroke. And then we'll get into the meat and potatoes is when the face starts to drop on one side of the body, the mouth starts to spiral, they just start blurring when they're talking, like blubbering. And then also too, if they notice that their arm, something's weakness in their arm or leg on one particular side, that's signs of a stroke. And then if the speech is off, they start to drag or bite their tongue, like I was saying, the blubbering. So that's where the S comes in fast, and Be Fast is what I'm talking about. And then time. So Be Fast, balance, eyes, face, arm, speech, and time. And that means that you need to call 911 immediately and not wait and think that you might be having, something else going on. So if you feel like you are, it's cheaper to pay that hospital bill than the years that it's going to cost you to do rehab and try to get your life back together. Or if it is possible to get it back together. Strokes can kill certain people if they have a massive stroke, but most people are left incapacitated for a period of time. And that's a whole nother issue to do it. So with all that being said and the dangers of strokes, let's talk about some of the ways that you can prevent the possibility of even having a stroke. Now, the other factors that actually need to be considered with this, if you have a family history of it, genetically, if your grandfather, your father, your mother, you're genetically predisposed to potentially having a stroke. Doesn't necessarily mean you're going to have one, but that's something that you need to pay attention to because your risks are a lot higher than that. But one of the things that you got to do is you got to make sure that you work on lowering your blood pressure. Number one cause of strokes is usually high blood pressure, overdose, uncontrolled, and that leads people to actually bodies start to break down. Then you want to lose weight. You want to make sure that you're not walking around overweight because that increases your chance of having a stroke. So looking at your BMI, your body mass index, set personal goals for weight loss, limit your calorie intake. There's different things you want to do it. Now going back to blood pressure, a lot of times people, they're lowering it what it should be. So you don't want to play around. You want to be as close to 120 over 80 as possible, even a little bit lower. And you want to exercise at least 30 minutes a day to lower that blood pressure. And then going back to the third thing, you want to exercise more. You want to make sure that you're exercising at least 4 to 5 times a week for at least 30 minutes a day. Whether it's walking, whether it's anaerobic exercise, where it's aerobic exercise as far as like cycling, swimming, jogging, or you can do any kind of strength training too that can help. Drink alcohol in moderation or not at all. I'm starting to get to the point now where there's nothing really good about alcohol. And most people overindulge in it, and that can actually contribute to other things like diabetes. It can actually add to high blood pressure. Some people think about the short-term benefits, but I'm more thinking about the long-term disadvantages of it. So you want to watch that. And then too, another thing that's popping up with a lot of people that's contributing to it. If you have AFib, that's atrial fibrillation. Those are symptoms where you get heart palpitations or shortness of breath. You need to see a doctor. There's different kinds of anticoagulant drugs that reduce the risk of that stroke that you could take with that. And then the sixth thing is you want to treat type 2 diabetes. If you're pre-diabetic or if you're diabetic with type 2 diabetes, you want to make sure that you keep your blood sugar under control, either with diet, exercise, medication if you need to take medication, if you know you're not disciplined enough to control it. And then you want to regularly check your blood sugar. Everybody can ask to get one of those finger prick tests, the glucose monitor, and then the lancet that you prick your finger and you drop the blood on the lancet and just measure it right there. You can do that right in your house. And also you want to constantly check your blood pressure. And then last but not least, you want to quit smoking. Smoking is just terrible. Smoking increases your chances of all kinds of diseases, not just having a stroke, not just having a heart attack, but also cancers. There's so many different things that smoke just increases, whether it's cigarettes, cigars, just smoke in general. It's not designed for human consumption. And there's people out here that smoke for years and their body's just adapted to it. But you don't want to take that chance with your body. So I hope that helps you with preventing a stroke. At this point in life, most people have known someone that has had a stroke or suffered from a stroke. Some people are very lucky to where they might have had a mini stroke or a TIA. And then some people are not as lucky and they could have actually been incapacitated where they can't function anymore. And then if some people are just not even here anymore because they didn't take the precautions. So don't ignore the warning signs. Always do your regular routine checkups with your primary doctor. Again, this is Dr. Artis.